Hello, I'm student Dr. Kirk Jones. This is week 7 material on home naloxone use. Naloxone or Narcan is an opioid reversal agent that can be life-saving in the right circumstances. Today we will be going over what it is, how to use it, and its importance. Why do people use opioids? People may initially start taking opioids to treat pain or to get a feeling of euphoria or a high. As people continue to use opioids, the feeling of euphoria decreases and feelings of withdrawal increase. This is known as tolerance and physical dependence, where someone will now have to take the same dose not to get a high, but just to feel normal and not sick. As people take larger doses of opioids more frequently, or stop taking opioids for a while and then resume their usual dose, they could accidentally overmedicate. What is naloxone or Narcan? When someone takes an opioid drug like heroin, fentanyl, or oxycodone, opioid molecules enter the body and cause effects like decreasing pain and producing feelings of euphoria or a high. At high doses, opioids can also cause users to stop breathing. Naloxone blocks and reverses the effects of opioid drugs. It can be used to reverse the effects of overmedication and can potentially be life-saving. I don't think I'm at risk for overmedicating with opioids. Why should I have Narcan? You or someone you know may have increased risk. It may seem like you are not at risk for accidental overdose, but there are many conditions that can increase your risk. Liver, kidney, and breathing problems increase your risk. Other risk factors include high doses of opioids, or switching between opioids, or also using benzodiazepines like Ativan or Xanax. Remember that accidents do happen, and it is safest to have access to Narcan should a problem occur. If anyone you know is using opioids, it is a good idea to have access to home Narcan in case of an emergency. Why is it important to have a Narcan plan? While you may not be at risk for overmedicating with opioids, your family or friends may be. Having Narcan on hand means you're ready in case of an emergency. Consider having a plan for who's on Narcan duty and make sure he or she is aware of how to access your Narcan and how to use it. When should I use Narcan? Narcan should be administered when you or someone you know has taken too much of an opioid drug and is having symptoms like difficulty breathing or trouble staying awake. Other signs include cold and clammy skin and very small pupils. How do I use Narcan? Most over-the-counter or home Narcan is given intranasally. If you or someone you know is experiencing symptoms of opioid overdose, administer Narcan as soon as possible. Place the person receiving Narcan on his or her back and give the first dose in one nostril. Administer rescue breaths by breathing into the person's mouth and put into the recovery position on their side like they're sleeping on their side. You may need to tilt their chin back to open their airway. To use Narcan, remove the nasal spray from the box. Hold the spray as shown. Slide the nozzle into the nostril until fingertips are touching the nostril. Then with a firm and strong push through the resistance, inject mist into the nose. You don't want it dripping out. One container is one dose, so use the whole thing. It may take several minutes for Narcan to take effect. If you need to step away, turn the person onto their side. Narcan takes 2 to 3 minutes to start working. Effects start to wear off between 30 minutes and 90 minutes, with an average of 60 minutes. Because the effects of opioid drugs last longer than the effects of Narcan, repeated doses may need to be given. It is important to call 911 for emergency medical services to make sure you get definitive treatment. While waiting for EMS, repeat doses every 2 to 3 minutes in alternating nostrils until medical assistance arrives. In Missouri, Good Samaritan laws protect people who seek medical help from minor drug and alcohol violations. This protects the person dialing 911 and the person taking the medication. It does not protect people with outstanding warrants. Here is more information on Missouri's Good Samaritan law. If there is a party, only the person making the call and the person receiving the Narcan should stay. Everyone else should leave. What are the side effects of Narcan? Side effects include dry nose, nasal congestion or discomfort, sweating, agitation, muscle aches and abdominal cramps, dizziness, headache, constipation, changes in blood pressure, racing heart, and symptoms of withdrawal. However, while it may be uncomfortable, it can be life-saving. Naloxone is like having an Epipen for someone with severe allergic reactions. It's essential to have around just in case. Where can I get Narcan? Check with the Suboxone Clinic for how to get the best price on Narcan. It is also available over the counter from a pharmacy. Contact the MOHO Project for more information about obtaining Narcan. If you have a primary care physician and private insurance, speak to them about obtaining a prescription to bill through your insurance. Thank you for participating in this. It takes a lot of strength to get where you are now. Stay strong and keep going.